Hi guys, John here. Have you ever thought about private healthcare for your health anxiety? I've had a lot of conversations recently about people talking about going private, paying a lot of money to either get something tested or to get Bupa or Vitality or a different kind of healthcare that is private, that's away from the NHS. This is kind of a video kind of focusing more on the UK health anxiety, but I guess on a wider scale. I don't really know how it works in other countries as much, but maybe your country has a similar thing. In the UK, we've got an NHS, which is where we get free healthcare. Everyone gets it, it's free, it comes out of the taxes. It's a great system, even though it's got a few flaws with funding in the past sort of 10 or plus years. But it exists and it's quite literally a lifesaver. However, something that scares people with health anxiety a lot is the underfunding of it has led to waiting times, and we hear a lot of this in the news. It's 6 weeks, 8 weeks, 12-week waiting times, longer, 6 month, a year waiting times for cancer treatments, and that means that people don't get discovered with a diagnosis early enough. And then we hear these stories of people getting late diagnosed and passing away. And if you've got health anxiety, believe me, that is triggering and that is incredibly anxiety inducing. And if you've followed my channel before, I have a few terms like spirals, triggers, all of this stuff, phases. And this is one of those things that for me can lead into a trigger of anxiety, and definitely it is very anxiety inducing as soon as you hear that. And there's been a few times, even from my personal experience recently, well, throughout my life, but most recent experience of this is I thought I had this pain in my side. Well, I've had it for kind of like a year on and off. And it is something that's kind of been on my mind. I'm 99% sure it's a muscle thing because I've been working out more and I think it's not healed. I've had blood tests, I've had a belly scan, I've had, doctor's appointments, and I've been sent for a referral. And all they found was fatty acid in my liver. Which apparently is very common, a bit of TMI into my health. But I was debating, because I've been put on this very long waiting list with to get a referral to look into it further to make sure it isn't anything. I had a chest x-ray as well, actually, just to add on to that. So a lot of things all came out completely fine apart from the fatty liver. And I was even debating recently, do I just pay for a test? And there's been times before when I've thought I've had something at the time when I was worried about my esophagus, and I was like, should I just pay for an endoscopy so I can get it sooner? Sometimes you get the 2-week thing with the NHS and it means you're fast tracked within 2 weeks for a test. That's reassuring, but it's the times when you're not fast tracked and it's almost like you feel like you're not being taken seriously. Like, for example, me, all of these tests have come back clear, so I'm just being tested because the pain is still there, so they're trying to just figure out a little bit more. But for me, it's like, I want to be on that 2-week list and I want to be seen and I want to be checked that everything's okay, because that's how health anxiety works. It's how can you function without the complete certainty that everything's okay. I saw recently this, I'd love to do a video about this thing in Germany where you can get a full body test of your whole body. I'm going to probably do a video talking about it, but you can pay like a few £100 and get a complete test in Germany or something of everything, just to check you're completely fine. I was like, this is a health anxiety's dream. I would love that. I always think, why are we not tested every year for just everything? Just so we can just go about our lives like, oh, I've got that test at the end of the year. I know that every single part of me is going to be tested. Health anxiety. Hello. But a lot of people I know have thought about getting private healthcare. Maybe you have yourself, either permanently with Bupa and Vitality, something that I've thought about, where you pay a monthly fee and then you've got access to GPs quicker and then referrals quicker, apparently. But also you've got people just paying for tests just outright, just to get it done sooner, so they can skip the waiting list, because the anxiety is that inducing. You know, even if you've not got the money, I've heard people tell me that they haven't had the money and they've gone into debt to pay for something that they just need it checked. They just need it checked. Here's my thoughts on the situation. On the idea of private healthcare. I myself have been on the Bupa website countless times, clicking through and going through to the end to think about getting private healthcare and getting a quote. And it isn't that much money. A few things have put me off. The thing of it not the bit of confusion between how much is like connected with your GP, and you've got to get your hospital notes from your GP and then send them over to, and which, because they've got to check for the pre-existing conditions, so it doesn't include any pre-existing conditions. So I've been tested for a lot of things, and I've got a hiatus hernia, and my worry would be, would there be a swingle of this is a pre-existing condition? That's kind of a little bit of a worry. And for me, the thing that's put me off as well is I've, in the past, apart from this odd occasion like my side, which is frustrating, every time I've been worried about something, I've got it sorted pretty quick. I've not really had many wait lists. I'm quite good at being like, I want to be on this 2-week list, and I want the 2-week list, and I want it out of my head, and I want to just get it tested. So knowing that exists, I'm like, 2 weeks is fine. Even though it can feel like a very long time. So those kind of things, I think if that 2-week list maybe went away and it was just extremely long wait times, even if it was something that the GP thought was cancerous, then maybe, and I have heard that they have obviously got a different kind of care for cancer and stuff like that with Bupa insurance. So it is something that I'm considering, but I'm not, but that's the things that have put me off in the past, and just sort of the questions that come into my head of like, this is all anxiety, but what happens if I get the health insurance, then I get diagnosed with something through Bupa, but then it can't go through to the NHS, and the NHS maybe have a better treatment for something. All of that stuff that hasn't happened isn't reality. As I say in my other videos, anxiety is not reality, it's anxiety. My cat, Blue, are you okay? Sorry, my cat's made a little meow. Have you thought about this? It really jars me when I hear, people, but I understand. I've nearly done it myself, pay thousands of pounds to get something seen. I had a conversation with someone recently, and she told me how she thought she had something. I forgot exactly what it was, but she paid a lot to get a treatment, and she just went there and then. She wanted to know that day because of a possibility that she had something. And I was like, wow, I can relate to that on such a big level. Will it help the health anxiety? Because I don't have Bupa, I don't have private healthcare, it's hard for me to say. Part of me thinks knowing that I've got it will reassure me because I know that it's there. Part of me does already think, how much will I be calling this GP line and, having it there. But I guess that's a good thing, it's not a bad thing to be able to speak to a GP and to go through your thoughts and to have honesty with them. So there's a lot of different factors and a lot of different thoughts that come into it. I'm kind of neutral about it, and the reason why I've held off myself is because of those reasons. I'm like, well, I don't feel personally disserviced by the NHS. I'm quite happy with my experience with the NHS, so like with my life and the support that I've had. But it would be nice to know that I could just have a GP appointment without calling at 8 a.m, which is something in England. You've got to call at 8 a.m, but not just call at 8 a.m. You've got to call kind of at weird times. Like, you don't really get it at 8 a.m. You've got to, because the line goes dead, you've got to keep calling for half an hour, 45 minutes. All anxiety inducing when you want an appointment and you need to speak to a doctor because you've got this lump or this pain or this symptom, and you're like, I need to get this checked. So what are your thoughts on private healthcare? If you've got health anxiety, have you got health anxiety and you've got private healthcare? Has it helped you? Or do you find like you seek reassurance more? That's an issue that worries me. Seek assurance is a negative thing that comes from health anxiety, where we're not finding calm ourselves. We're seeking answers from other people, doctors, friends, the internet. So if that option's there, does that feed into it a little bit more? I don't know. I'm debating getting Bupa at some point myself, just for the reassurance, just because I think health is more important than anything else. And if it's 20, 30 quid, fine. If it's more than that, different, because I know there's different levels of it, which is crazy to me as well. But yeah, I'm a bit worried about this pain in my side at the moment. I'm going to have just full transparency with my health anxiety. I have this pain in my right side all year. Not an excruciating pain, mainly when I'm exercising, which does make me think it's muscle related. And I did have the test that all came back negative, which did reassure me, apart from one that was equivocal or something, for the fatty liver and something else. That's why they've sent me for this follow-up test from August, and I've still not had the follow-up. But I'm hoping that's my only... It's not been on my mind. Well, I'm not going to lie, it has been on my mind, but it hasn't been like a phase like I've had in the past. I've got a lot more grasp over my health anxiety and just where my brain's at. And knowing now it's late, it's night time now when I'm doing this video, knowing now that this is when my anxiety is the worst, and I'll wake up and the thought will be gone. Like I always feel like that. So if that's you, go to sleep. I'm going to finish this video now, but yeah, let me know what your thoughts are on private healthcare if you live in the UK, how it works if you're beyond the UK, and how that works with your health anxiety. Does it, whatever the process there, does it help or does it hinder? I'd love to hear about it. Subscribe to my channel, Ease with John, videos every Tuesday and Friday.